Up Close with Chris Williams is presented by Tennova Healthcare, with 6 hospitals and more than 1,000 dedicated physicians. For more information, tennova.com.
Welcome to Up Close. I'm Chris Williams. On this edition, I will visit with a young lady who is working in what was once a male-driven profession. And while many of you may think she has come a long way, she continues to break down barriers. Dr. Marcella Greene is a Tennessean who grew up in a very rural area. She has always been one to set high goals and standards for herself. When I had an opportunity to visit with her, I immediately asked her about her childhood in Tennessee. First of all, Dr. Greene, tell me a little bit about, I guess, your early life and your childhood and where you actually grew up, a little bit of your history.
Well, I grew up on a farm in McDonald, Tennessee, and a lot of people may not know where that is, but it's situated between Cleveland and Chattanooga. As I said, I grew up on a farm, and I think I gained my work ethic from my father, who worked very hard on the farm, and my compassion from my mother.
What type of farming was your family involved in?
Well, we had gardens. We had many different gardens. We would sow and mow hay. We had animals. We had cows, goats, pigs, chickens. So we had just about everything you can think of.
You made the decision actually to become a general surgeon in what many consider to be, or maybe you would later in life. Tell me about that.
Well, when I was in high school, I didn't like school, and I did not want to go to college. I met my husband when I was in high school. He's a little older than I am, and we got married as soon as I graduated high school. We're still married 26 years this year.
Congratulations.
Thank you. And I had a few other opportunities in banking and in retail and fashion industry, but I didn't think those fit me quite well enough, so I was searching for a career. I was lucky enough to work with an oral surgeon, Dr. Wayne Tips, in Chattanooga, and that's how I got interested in medicine and especially surgery.
Very interesting. So what made you finally decide this is something I'm going to go for?
Well, when I originally decided I wanted to enter the field of medicine, everyone thought I would enter family medicine or primary care, and I thought I might as well, being a non-traditional student. And when I was in medical school, I just really loved my surgery rotation, and I've always enjoyed working with my hands. So it seemed to be the right fit for me, general surgery.
Was it easy to make the determination to stay in the state of Tennessee?
No, not at all, not at all. I love the state of Tennessee. Grew up, of course, in a small town in southeast Tennessee. I did my residency and my medical school in northeast Tennessee. And my family and my husband's families are here, and we love the state of Tennessee, so we're happy to be here.
So you decided to stay home.
Oh, yes.
You are in what many consider to be a male-dominated field. I was hoping that you might address that for me.
Well, there are more men surgeons, this is true. For a long time, there were more men in medicine as well, but that trend is changing. Now, our medical school population is more than 50% female. General surgery is lagging behind just a little bit, but I think currently about 20% of general surgeons are females, but I think we'll see that trend change as well as more women are starting to enter residency programs for general surgery.
So right now there really isn't what we would consider a glass ceiling for...
No, not at all. And I was very fortunate to have wonderful mentors, female surgeon mentors during my training program. So,
I was reading a story about a married couple. They're both general surgeons, and they have small children, family, have to get them up every morning, breakfast, daycare, diapers, and they were really, really emphasizing the fact that scheduling is so important in order to pull off everything that they need to pull off on a daily basis. How important is scheduling for a general surgeon?
Well, it's very important because if you let surgery can encompass your entire world. And I love general surgery. I love the variety of general surgery, but I also love my home life. So I do make time and make sure that I have special time set aside for my husband and I.
You're already in your second year as a general surgeon. What are some of the things that maybe you've learned in this duration of time that maybe were different, unique, or kind of surprised you about the field and what you do?
Well, I think when you finish residency, you're nervous about entering the field on your own. I think the most important thing is having good partners to work with you and people who are experienced in the field. And I was certainly lucky enough to find a great group and have mentors in this group as well who are available to help in case I need to call on them in surgery.
So what are some of the reasons that you might actually call on them for their help?
Well, if I am unable to identify the anatomy like I want to or need to, or if it's a complicated procedure that I haven't done enough of on my own, I would ask for their help until I was comfortable with that procedure on my own.
I want to delve into some of the actual surgeries that you perform. What type of surgeries do you do for, say, breast cancer or breast disease?
For breast cancer, there are several options for women. It used to be that the only option for women was mastectomy and removing the lymph nodes in the axilla. Research shows us, though, that there's no mortality benefit to having a lumpectomy or removing a lump of breast tissue surrounding the cancer with good margins that have no cancer, followed by radiation therapy and maybe chemotherapy, just depending on the size of the tumor. But women have options now. They can actually save the breast if it is localized to one part of the breast and not multifocal. It is possible to save the breast.
My mom is a breast cancer survivor, so it is so good to hear that. So I would imagine that's giving a lot of people hope for the future.
Yes, and if a woman chooses mastectomy, she can also choose reconstruction. We work closely with plastic surgeons who can come in and do the reconstruction phase 1 immediately after we do the cancer surgery of mastectomy.
You also perform what is called intra-abdominal surgery for problems or intra-abdominal disease. For the layman person at home watching, what do we mean by that?
That simply means the abdominal cavity, which has the stomach, the small intestine, the large intestine, the appendix, the liver, the spleen. That means intra-abdominal. Those are the intra-abdominal organs. So just below the skin and the soft tissue and the strength layer of the abdomen lies the intra-abdominal cavity.
You also perform surgery on soft tissue, skin tissue. What are some of those, I guess, situations where that may be necessary to do?
Well, in the case of a skin cancer or a lesion on the skin that looks suspicious that I'm worried might be a cancer, that would be a reason to remove that. There are also some benign lesions that people just want removed if they are causing pain or if they're unsightly.
So can that be a tough call to make? I guess a lot of times when people come to you and it's unsightly, you want to advise them with your best knowledge and your recommendation. Can that sometimes be a tough call to make?
Well, a lot depends on, the patient. I talk to them carefully, discuss the risks and benefits of surgery because there's always a risk involved with any surgery that we do. And if it's something that the patient really wants and they're willing to take the risk to have surgery, and it looks like a suspicious mass, then yes, I would proceed.
Let's talk about thyroid surgery and parathyroid surgery. Pretty big term. when is that necessary? What is it? Could you kind of give us an insight to that?
Well, the thyroid gland can have benign nodules, or it can also have cancerous nodules. 80% of nodules in the thyroid gland are benign, but they can grow to a size where they compress the trachea and make it difficult to breathe. These are usually called goiters. If they become large enough to where they're causing difficulties with breathing or swallowing, then we would take them out even for benign disease. If there is a nodule in the thyroid lobe that is cancer, then certainly we would want to remove either the lobe that is affected or the total thyroid gland, depending on the type of cancer.
So do we know what causes this initially?
What causes the cancer?
Yeah, and the problems and I guess the growth, even if the tissue is benign?
Well, no. There are some cancers that are hereditary in thyroid cancer. Those are very rare. Most of the time they arise from normal thyroid tissue and become cancerous. There is some association with previous exposure to radiation, but other than that and a genetic component, that's all we know about how those cancerous nodules arise.
You also do surgery on the adrenal glands.
Yes.
Will you tell me a little bit about what is involved in that?
Well, the adrenal gland, of course, is situated right above the kidney on each side. The adrenal gland does a lot to control our hormones in our body, especially the steroid release in our body, corticosteroids and mineralocorticoids. So the function of the adrenal gland is very important. Sometimes people will have a benign adrenal nodule that is overproducing, causing symptoms, and that would be a reason to remove that that adrenal gland. Other times the adrenal gland can have cancer. That's very rare, but it is possible.
Out of all the surgeries that you do, is there a favorite surgery that you like to perform? Maybe one that appears more simple or you feel like has better results than other ones or easier to accomplish?
Well, no. I enjoy the variety of general surgery, and that's why I chose general surgery. When I was in my training, I, of course, got to see all the different specialties of surgery off of general surgery and considered a few of them, but as I progressed in my residency, I found that I really like variety. So, a perfect day would be a soft tissue mass, a gallbladder, a hernia, followed by a thyroid or a parathyroid. That's not very common to have all that variety in one day, but that's why I chose general surgery.
You mentioned the gallbladder, so I want to go into my next part of our discussion. You are actually achieving the removal of the gallbladder through laparoscopic robotic surgery, a pretty big term. What is meant by that?
Well, laparoscopic surgery is surgery with small incisions, one for a camera to be placed in the abdominal cavity, and a few other small incisions for working instruments. Robotic assisted laparoscopic surgery is achieved with the use of the robot as well. What is nice about the robot is that it gives you three-dimensional picture, so you can actually see the 3D image as if you were inside doing open abdominal surgery. As with traditional laparoscopic surgery, you only get a two-dimensional view of those organs. So there are a number of benefits to the robotic-assisted laparoscopic surgery. And for the right patient population, it can be done through one single incision at the umbilicus, or at the belly button, which can hide a scar to where you hardly recognize anyone has had surgery at all.
So when is that type of surgery necessary?
Well, if a patient is having symptoms from their gallbladder, meaning abdominal pain, usually located in the right upper quadrant or just under the sternum, or pain that radiates into their back or shoulder blades, nausea, vomiting, bloating, some people say they have diarrhea with it as well. If our workup finds that the gallbladder is the cause of those symptoms, then it's appropriate to remove the gallbladder.
So if you have the gallbladder surgery, what are some of the side effects afterwards?
Well, immediately postoperatively, of course, is pain, but that usually goes away within about a week. And with the robotic-assisted surgery, people usually recover a couple of days before traditional laparoscopic surgery. Occasionally, we still have to do an open gallbladder surgery if we can't identify the anatomy because of acute inflammation, if there are other structures in the way that impede the view of laparoscopic or robotic surgery. Those will be indications to open and complete the surgery as an open surgery. That rarely happens, but it does still happen occasionally. So an extended hospital stay would be necessary for a patient if they had to have open abdominal surgery. But as a general rule, a complication or a finding after gallbladder surgery, after the gallbladder is removed, some people do have diarrhea shortly after a meal, and most of the time it's a self-limiting process that the body figures out and compensates for on its own, but occasionally people will have to take medication, sometimes for the rest of their life, for diarrhea after their gallbladder is removed.
So what type of diet do you suggest after the gallbladder is removed?
Well, always a low-fat diet is the best recommendation, staying away from greasy, fried foods and a low-fat diet.
You mentioned that there are times when the robotic assisted surgery is not the best option. Can that be difficult to determine if there's actually an open surgery required, or?
Sometimes you don't know until you get a camera in and take a look at the organ, at the anatomy, and to see if it's suitable for a laparoscopic surgery. We almost always try to do a laparoscopic or a robotic surgery first, take a look at the situation, and then evaluate, and if we need to, open from there. But that happens very rarely.
As a physician and as a surgeon, how important is bedside manner to you?
It is very important. Patients, when you're seeing a patient for the first time, they really need to be able to trust you. So the bedside manner actually establishes a rapport with the patient to allow them to trust you and to trust what the surgeon feels is necessary treatment. And that patient puts their trust in you to complete a surgery for them, and you're, taking care of their abdominal organs or their breast cancer or their thyroid, their parathyroid. So afterwards, it's just as important to maintain that relationship and take good care of the patient postoperatively. I want all of my patients to feel as if they are treated as someone in my own family would be treated. So bedside manner is very important.
So do you have a lot of situations where patients come to you and maybe they're terrified or they're really frightened when they hear the big S word when you mention the word surgery?
Yes, I do. And we talk about the surgery in detail. I try to calm any fears that they may have, and as long as it takes to talk with them and reassure them and to make them feel comfortable, that's what we'll do. So occasionally my clinic may run a little bit longer, and that's okay. Most of my patients understand that because I talk to them in detail and I want them to feel comfortable.
So do you have a lot of pride in the fact that every day you're pretty much being a part of helping people save their lives?
Absolutely. It's the best part of my day, knowing that I'm helping someone. And I really love what I do. So I'm very lucky and very blessed to be in a field where I get to go to work and love what I do every day.
So what is your typical day like?
Well, my typical day is to get up in the morning, come to the hospital, round on my patients who are in the hospital, and do surgeries in between. And 2 days of the week, well, 1.5 actually, I see patients in my clinic. So I try to put all of that into 1 week.
So what time is usually the time you arise in the morning, and can it be a pretty long day?
It can be a long day. I usually get up at about 5 or 5:30, and sometimes my day is not over until 5 or 5:30 in the evening. And sometimes, of course, when we're on call, it's extended to the next morning. But it can be a long day, but it's still very fulfilling knowing that you're able to help someone. And sometimes you're helping them through a life-threatening situation.
You mentioned earlier when we were talking about the importance of having good mentors. And I believe that that is necessary probably in any field. Why have your mentors been so important to you here?
Well, when I interviewed with the group of surgeons here, Dr. Garber, Dr. Harrell, Dr. Wiest, and Dr. Peebles, I found that they worked very closely together, and they made me feel very comfortable. And I got to shadow and walk around with Dr. Garber during rounds. I found that he treated his patients just like I wanted my patients to be treated, as far as talking to them, and he actually treated patients like my mentor in residency treated patients. So I really enjoyed that. I also got to see some of the operations with Dr. Wiest and Dr. Peebles and Dr. Harrell. And I saw the quality of surgeons that they are, and it just made me feel comfortable coming to a group with quality surgeons with good bedside manner.
Let's address, if we could, some issues of advice. And you know that in the viewership of this show, there are so many rural areas. We've even had people tell us that, you know, sometimes the PBS station is the only station they receive at their home. Somebody in that very small town is watching right now, and they have some pretty lofty goals to maybe do something that you've done. What would you say to them?
I would say take one day at a time. If you look at the big picture, it can be overwhelming. But if you take one day at a time, you will reach your goals. And just find your passion and stick with that. Remember your passion and just follow the path that leads you to that.
And here in the state of Tennessee, I'm going to ask this because we have so many people who enter the medical field. There's a young lady out there watching right now, and you've inspired her considering becoming a surgeon. What direct advice would you have for her?
I would say find some female mentors, because they can help you in what is currently a male-dominated field. But there are those of us who have done this and love it and are very happy in the field. And I would say just seek out a female surgeon who can mentor you.
What are the educational requirements for where you are right now in your career?
Undergraduate degree first, which can be 4 or 5 years, usually in one of the sciences, but not necessarily, followed by 4 years of medical school training. And currently, general surgery training is a 5-year program.
Okay. Thank you so much for talking with me.
Thank you.
I think we all learned something watching this show. A very special thanks to you at home for watching, and a huge thank you to Dr. Marcella Greene and her entire team. For Up Close, I'm Chris Williams.
Up Close with Chris Williams is presented by Tennova Healthcare, with 6 hospitals and more than 1,000 dedicated physicians. For more information, tennova.com.
I'm quite flabbergasted by this. It's a collection of pieces of cake. Now, they're royal pieces of cake, aren't they?
Oh, yes.
And before I describe just a couple of these pieces of cake, I want you to tell me how you come to have them.
Well, my mother lived in Windsor, and she had a friend, had connections in Windsor Castle, and that's how we got it.
Right, okay. Well, let's describe some of the things in this box, because around are some peripheral items that I've dug through, one of them being a piece of silk from Queen Victoria's train, apparently. But it becomes even more exciting when we dig in to the cake, because if we take this piece out, wrapped in cellophane here, and read it, it says, a piece of Queen Victoria's 80th birthday cake, 1899. We have a very strong tradition in this country of giving cake out after weddings or birthdays or whatever.
Yes.
And for those people who may have been absent or just purely as souvenirs, we send them pieces of cake. And here we have, in the 19th century, prime examples of this tradition. And I am absolutely staggered because we've got bits of fruitcake here that are 120, 30, 40, 50 years old. The Queen's Jubilee cake, June 1887. And I'm reading off the labels because I have to be honest with you, what's incredible is that someone has annotated these mainly in the same hand by the looks of it. So I'm having to take it that that's correct. I'm kind of staggered by all the little royal connections going on in this little box. According to the inscription here, this box appears to have been worked by the Princess Royal, Queen Victoria's daughter, who later became Empress Frederick of Germany. Do you know, it's possibly one of the most difficult things I've ever tried to value on an Antiques Roadshow. I've counted quickly in there and I can see 16 pieces of fruitcake with a casket with royal provenance, or, you know, I'm taking by the label that it's got royal provenance, and lots of peripheral items as well that have royal connections with Victoria. And do you know, I really think this is worth between £3,000 and £5,000.
I really no idea anything like that.
I think I may have even surprised myself.